Welcome back. Well, some of you guys might be battling GI tract disorders that could be treated with what's called foregut surgery. Dr. Wesley Love is a surgeon at Cahaba Valley Surgical. He joins us now live to explain the benefits of this surgery and explain who could be a good candidate for this surgery. First, we want to say good afternoon to you, Dr. Love. We appreciate you taking time out of your busy day to chat with us a little bit about this. So first and foremost, what exactly is foregut surgery? Can you explain what that is?
So typically, the foregut is a term that applies to the esophagus and stomach, mostly, with a little bit of the duodenum. But for the most part, when you think of foregut surgery, people typically tend to think of surgeries that are performed for reflux. And so these are patients that have tried things like Prilosec or Zantac or whatever medication to control their heartburn reflux issues, and it's helping. They've typically seen their GI physician by this point and had endoscopy or something of that nature before they surgery. But the bottom line is that they're operating form to help alleviate either reflux or difficult to swallow. And of course, bariatric well on the foregut part of that area with a gastric that's actually flux as well as go right there.
I hate to cut you off. We're actually having some issues with our connection. Can you just say a couple words for us just to make sure that connection's okay? Can you, Alex? Can you guys hear me okay in the booth? Okay, yeah, you're cutting in and out. We're going to try to keep going, and if things don't clear up, we're going to have to, of course, wrap things up. But we're just going to keep going for now, and hopefully technology's on our side. So you were explaining exactly who would be or what that surgery is, but who is the ideal candidate for this type of procedure?
So the ideal candidate would be a patient who is a non-smoker and is typically fairly fit, but otherwise just has continuous significant issues with heartburn or reflux, and they've kind of gone through all the medical pathways and are still not getting relief, and they have good normal esophageal function and normal GI anatomy. They're a good candidate to undergo something like a fundoplication, where they actually have part of their stomach wrapped around their esophagus to help create a valve so that things can come in easily. But the reflux and stomach acid doesn't just go backwards and burn things quite as easily, and it tends to give them a lot of symptom relief, but it still allows them to eat normally.
So this is a surgical option to treat one of the many issues you mentioned. What are some of, I guess, the steps that you should go through before you decide that this surgery is the only thing that's going to work for me and whatever I'm battling right now?
Sure. For me, I would typically like the patient to have had some form of upper endoscopy, as well as upper GI imaging. So typically a dye test, swallow some dye, take an X-ray of it, and then also something called a pH study, where their probe is placed within the esophagus, and the patient actually has a button where they can press when they're having symptoms, and that will help us correlate with, yes, your stomach acid going backwards is indeed what is causing your pain. And the final thing we'd like them to have before operating is something called an esophageal manometry, to make sure that they are also not having problems with esophageal dysfunction, meaning when they swallow, food is not going down correctly. Because if the patient also has an issue with that, you don't just want to knee-jerk to a full fundoplication. You may alleviate their reflux, but you may also cause them to have some difficulty swallowing after the operation. So you want to make sure all your ducks are in a row before you commit someone to this.
All right. Well, Dr. Love, we appreciate you joining us this afternoon and giving us some insight on the foregut surgery option for people with various upper GI tract issues. We appreciate your time. Have an awesome afternoon.
Well, thank you very much. I appreciate the opportunity.